There is something sitting in your medicine cabinet right now that could be slowly killing you. It's not a poison. It's not illegal. You bought it yourself at the pharmacy. You might have taken it this very morning with your breakfast. And the scariest part of all, the doctor who recommended it probably never told you what I'm about to share with you today. For years, I've watched perfectly healthy people, active people, people who watch what they eat and go for walks, end up in the emergency room. And when we go through their medical history, the same pattern keeps showing up. It's not cigarettes. It's not alcohol. It's something nobody suspects. If you are over 55, or if you have an elderly parent or loved one, what you are about to hear could literally be the difference between life and death. I'm not exaggerating. Stay until the end, because every single point on this list matters. For decades, we've been telling people to take care of their hearts. Don't smoke, eat well, go for a walk. And people try. But there is something nobody is saying out loud. Something the pharmaceutical industry is not going to put in a television commercial. Something that many doctors, with all the pressure and limited time they have, simply don't get the chance to explain in a 10-minute appointment. There are over-the-counter medications, pills you buy without a prescription, supplements that seem completely harmless, that in people over 60 are quietly, invisibly raising the risk of heart attack, irregular heartbeat, and heart failure. And what makes this problem especially dangerous is this. Because you don't feel sick right away, you assume everything is fine. The damage builds up day by day, week by week, for months or even years, until one day the heart simply says enough. Today, we are going to talk about 5 types of medications. I'm going to tell you real stories. I'm going to explain exactly what these drugs do inside your body, and I'm going to give you concrete steps you can take starting tomorrow. Let's begin. Think about the last time something hurt. Your knee, your back, your head. What did you do? You probably opened the drawer, pulled out an ibuprofen or a diclofenac, and that was it. Problem solved. Almost everyone does this, and nobody blames you. They work, they're cheap, and they're in every home. But here's the story you need to hear. Robert was 72 years old. An active man, he loved gardening, tended to his roses every afternoon. He suffered from arthritis in his knees, and because the pain wouldn't let him work in his garden, he took diclofenac almost every single day. No prescription, no consultation, like it was candy. One Tuesday afternoon, while pruning his favorite roses, he felt like he couldn't breathe. He sat down. It didn't get better. His ankles were so swollen, they wouldn't fit in his shoes. His son rushed him to the emergency room. The diagnosis was acute heart failure. Robert didn't have a serious cardiac history. His blood pressure was slightly elevated, yes, but nothing out of the ordinary for someone his age. The real trigger, the one nobody expected, was that anti-inflammatory he had been taking every day like it was completely harmless. How can this happen? The mechanism is fascinating and terrifying at the same time. Non-steroidal anti-inflammatory drugs, ibuprofen, naproxen, diclofenac, work by blocking enzymes that produce inflammation. So far, so good. The problem is that those same enzymes also protect the kidneys and blood vessels. When you block them, 2 devastating things happen. First, the body starts retaining salt and water. Imagine your heart is a pump. Now imagine there is suddenly 30% more fluid in all the pipes. A young pump handles that. A pump that has been working for decades, with slightly stiffer walls, fighting against high blood pressure, that pump can break down. Exactly like what happened to Robert. Second, these drugs constrict blood vessels and raise blood pressure, even in people who are not hypertensive. And if you already take medication for your blood pressure, ibuprofen can completely cancel it out. Your pressure goes up without you even noticing. No symptoms, no warning signs. The FDA issued an official warning about this back in 2005. We have known for 20 years that this can kill people, and yet ibuprofen is still sold at the grocery store like it's nothing. There's one more thing most people don't know. If you take low-dose aspirin to protect your heart, ibuprofen can cancel out that protective effect too, meaning you remove the only safety net you had. So what can you do? This isn't about suffering in silence. It's about choosing better. Acetaminophen is often enough for everyday pain and is much safer for the heart. Anti-inflammatory gels and creams work locally without entering the bloodstream. And if you truly need an anti-inflammatory pill, talk to your doctor. The rule is simple: the lowest dose possible for the shortest time possible. Now let's talk about something that is going to surprise you, because this next one is actually marketed as a protector. Omeprazole, pantoprazole, lansoprazole, proton pump inhibitors. They are among the best-selling drugs in the entire world. Millions of people take them every morning with their coffee, almost like a vitamin, for acid reflux, for heartburn, or simply because someone told them that if they took anti-inflammatories, they needed to protect their stomach. Helen was 68 years old. She was prescribed omeprazole for chronic acid reflux. She was told to take it indefinitely. Her heartburn disappeared. She never questioned it. Why would she? She felt fine. Years later, at a routine checkup, her electrocardiogram showed something strange. An irregularity in her heart rhythm, an arrhythmia. A blood test revealed the cause. Her magnesium levels were dangerously low. Magnesium is one of the most critical minerals for the heart. It regulates the electrical rhythm of the cardiac muscle. When magnesium is missing, the heart becomes electrically unstable. Think of an orchestra where the conductor suddenly disappears. Every musician plays at their own tempo. The result is chaos. And that chaos in the heart is called an arrhythmia. The cause of Helen's deficiency was the omeprazole she had been taking every single day without a second thought. Why does this happen? Because stomach acid, even though it seems like the villain, is actually essential for absorbing minerals like magnesium. When we suppress that acid for months or years, magnesium absorption collapses, and the heart pays the price. But there's more. Several observational studies have found a connection between long-term use of these drugs and a higher risk of heart attack. The most accepted theory is that they may reduce levels of nitric oxide, the molecule that keeps arteries flexible and open. Without it, arteries stiffen, and stiff arteries are arteries that get blocked. On top of that, omeprazole interferes with clopidogrel, a blood-thinning medication prescribed to patients who have already had a heart attack to prevent another one. When you take both together, omeprazole can reduce the protective effect of clopidogrel by up to 40%. A patient who thinks they are protected simply isn't. These medications were designed for short-term use, 4 to 8 weeks, not to be taken for life. But they have become a permanent fix for a problem that in many cases could be managed with simple lifestyle changes. If you have been taking one of these drugs for months or years, don't stop suddenly. That can also be dangerous. But talk to your doctor. Ask, do I still actually need this? Can we lower the dose? Are there alternatives? And if you do need to take it long-term, ask your doctor to check your magnesium levels regularly. If what you're hearing right now is opening your eyes, there is one simple thing I'm asking you to do. Subscribe to this channel and share this video with someone over 60 that you care about, a parent, a friend, a neighbor. That one click from you could start a conversation that saves a life. Thank you. Let's keep going. Now we get to one that almost everyone has at home. And this one shocks people the most because it's for something so small, a stuffy nose. Martha was 75 years old, a retired teacher, active, independent. She caught a bad cold in the middle of winter. She went to the pharmacy and picked up a well-known decongestant, the kind advertised on television, with pseudoephedrine to clear her nose. By the second day, she felt like her heart was pounding out of her chest, dizziness, a crushing headache. Her son found her pale and confused and rushed her to the hospital, blood pressure through the roof, cardiac arrhythmia. A simple cold remedy had pushed her to the edge of a heart attack. Pseudoephedrine and phenylephrine, the active ingredients in most oral decongestants, are vasoconstrictors. Their job is to narrow blood vessels. In the nose, that reduces swelling, and you can breathe. Perfect. The problem is that the drug doesn't know the difference between the blood vessels in your nose and the ones in the rest of your body. It travels through the entire bloodstream, narrowing everything. The arteries around the heart, the ones in the brain, the ones in the kidneys. The heart has to pump against much greater resistance, like trying to blow through a crushed straw. Blood pressure spikes. A young, healthy heart can take that. A 70-year-old heart with slightly stiffer walls may not be able to. And on top of that, these drugs are stimulants. They speed up the heart rate. If you already have a sensitive heart or an undetected arrhythmia, that extra stimulation can trigger something very dangerous. European medicine agencies have recently refocused attention on pseudoephedrine because of its link to a serious syndrome involving severe narrowing of blood vessels in the brain. Rare cases, yes, but real. The biggest danger is that these are sold over the counter, no prescription needed. People buy them without reading the label, without thinking that a pill for a runny nose can send their heart to the emergency room. If you are over 60, if you have high blood pressure, if you have any history of heart disease, Stay away from these products. Saline nasal sprays, humidifiers, and nasal steroid sprays are much safer and nearly just as effective. Don't let the relief for your nose become an emergency for your heart. This next one is sensitive because we're talking about mental health, and I want to be absolutely clear. Treating depression is completely necessary. Untreated depression is itself a massive cardiovascular risk factor. The problem is not treating depression. The problem is how it gets treated. There is a class of older antidepressants that are still being prescribed, especially in elderly patients, sometimes for chronic pain, sometimes for depression. They are called tricyclic antidepressants, amitriptyline, imipramine. You may have heard those names. Francis was 78 years old, a diabetic. He suffered terrible pain in his feet, that burning sensation that comes with diabetic neuropathy. His doctor prescribed a low dose of amitriptyline to help manage that pain. It worked. The pain improved. But he started getting dizzy every time he stood up from his chair. One Tuesday morning, he fainted in the bathroom. He fractured his hip from the fall. The amitriptyline was causing a sudden drop in blood pressure every time he stood up. In older adults, those few seconds of dizziness can mean a fall, a fracture, weeks in bed, and a cascade of complications that can be fatal. But that is not the only cardiac risk. Tricyclics also speed up the resting heart rate, a constant silent stress on a heart that is already working harder than it should. And most seriously, they interfere directly with the electrical system of the heart. They slow down the electrical impulses that coordinate each heartbeat. This raises the risk of ventricular arrhythmias, the kind of arrhythmia that can cause sudden death. This is exactly why tricyclics are no longer the first choice for treating depression in older adults. There are newer antidepressants that are equally effective and far safer for the heart, yet they are still being prescribed. If you or someone in your family takes one of these medications, ask your doctor directly. Are there safer alternatives for my age? Is my blood pressure and heart rhythm being monitored? Mental health and heart health are not two separate worlds. You have to make sure the treatment for one is not quietly damaging the other. And now we arrive at number one, the most controversial point on this entire list. The one most people are going to push back on in the comments because they have been hearing the exact opposite for decades. Calcium supplements. Yes. Those white pills that millions of older adults take every single day to protect their bones, for osteoporosis, to avoid fractures, taken faithfully every morning because it seems like the responsible thing to do. Lucy was 70 years old. No classic cardiac risk factors. She didn't smoke. No high cholesterol. Perfect blood pressure. She exercised. She ate well. She took her high-dose calcium supplement every day without fail, because she had osteoporosis and wanted to protect her bones. One day, she had a heart attack. When her medical team investigated and ruled out the usual suspects, the focus eventually fell on that daily supplement. The calcium you eat in food, in dairy, in green vegetables is absorbed slowly. The body takes it, uses it, and manages any excess without a problem. Calcium in a pill is a different story. When you swallow a concentrated dose all at once, you create an artificial spike of calcium in the blood. The body cannot instantly use all of that calcium for the bones. It has to go somewhere. And the main concern among researchers is that part of that excess calcium gets deposited in the walls of the arteries. This process is called arterial calcification. The arteries become stiff. They lose elasticity, and that stiffness contributes to forming the plaques that block arteries and cause heart attacks. There are large studies suggesting a modest increase in cardiovascular risk with these supplements. Other studies have found no such connection. Science does not yet have a definitive verdict. But the lesson that is absolutely clear is this: more is not better. If you have diagnosed osteoporosis, the benefits for your bones may outweigh the risks for your heart. That is a decision your doctor needs to make, not you standing alone in the pharmacy aisle. The safest strategy is to get your calcium from food. If your doctor believes you need a supplement, it should be the lowest effective dose, combined with vitamin D and with regular reviews of your cardiovascular risk. Never start calcium supplements on your own. It might feel like you're just taking care of your bones, but your heart could be paying the price. Today, we talked about 5 types of medications that almost everyone considers completely harmless. The anti-inflammatory for the knee, the pill for the stomach, the cold remedy, the antidepressant for pain, the supplement for the bones. None of them have a skull and crossbones on the label. None of them make you feel sick right away. All of them seem perfectly reasonable. And all of them, under the wrong circumstances, can silently weaken the heart of an older adult. And here's the single most important message of everything you have heard today. Do not stop taking your medications on your own. That would be a very dangerous mistake. What you need to do is become an active patient, not a passive one. The next time you see your doctor, bring a list of everything you take. Pills, supplements, vitamins, everything. And ask these questions directly. Is this medication still the best option for me at my age? Are there alternatives that are safer for my heart? Is there anything we should be monitoring, like blood pressure, magnesium levels, or heart rhythm? That simple conversation, the one you may have never had with your doctor, can change the entire direction of your health. Your heart has been working without rest for decades. Every beat, every second, no breaks, no days off. It deserves to be protected with the same dedication it uses to protect you. Share this video with your parents, with your grandparents, with that friend who takes ibuprofen every single day, with that neighbor who has been on omeprazole for years. Don't do it to be the person who knows the most. Do it because sometimes one conversation at the right time changes everything. Take care of yourself.